Hello, farmers, parents, and just about anyone. First of all, thank you for clicking on this video. May is Lyme Disease Awareness Month, and if you were like me, I didn't really worry about Lyme disease. I thought nothing much of it, but I recently met someone whose daughter has been dealing with Lyme disease for 8 years. And I wanted you guys to know that Lyme disease is very serious, and I wanted to show you how you can protect yourself. But just so that you understand how serious I'm talking about, my friend's daughter contracted Lyme disease at 6 years old from a tick, and she has chronic fatigue. She lost the use of her legs for weeks at a time because you see, Lyme disease affects the nervous system, so it can affect many parts of your body, and the worst case for Lyme disease is heart problems and heart failure. So from my heart and from my friend's heart to yours, to your children's, please take just a minute to listen to this video about how to protect yourself from Lyme disease. I also want you to know that we're having a live Q&A tomorrow, Friday afternoon at 4 p.m. Central Standard Time. Please join us with any questions that you have about Lyme disease. I will be the host, but my friend who's very knowledgeable about Lyme disease will be there in the chat, and we will discuss any questions you have about Lyme disease. So without further ado, let's talk about how to protect yourself from Lyme disease. First of all, for your skin, this is what I choose. This is a lemon eucalyptus spray. This is DEET free, and this is actually at the top of the list of a good way to protect yourself and your children from ticks. I like this because it is natural and DEET free. You can also use other kinds of tick repellent that you can purchase at your local Walmart or whatnot. The next thing that I did not know about and I am now using is called Permethrin. I will link all of this below. This says livestock and premise spray. What you do with this is you dilute it. I am also spraying this on my dogs. Do not use Permethrin on your cats. It is too strong for them. So this is for your clothing, your dogs, and your dogs' beds. You can get this at Tractor Supply. This was $7, and I'm pretty sure this will last me quite a while. So I have sprayed my shoes and my clothing that I use when I go outside. The second thing to know is that if you get a tick on your body, you need to use tweezers. You need to pull the tick straight out. Okay? One thing to know also, do not use Vaseline. Vaseline will cause the tick to regurgitate. And if that tick has Lyme disease, it is regurgitating Lyme disease into your skin. Okay? No Vaseline. Pull straight out from the head with tweezers. Now, if you want, you can take your tick and you can send it in to be tested by the health department. You take the tick, put it in a plastic bag with cotton balls, moist cotton balls, and you send it to the health department and ask them to test it for Lyme disease. Okay? Now, if you think that you have been infected or bitten by a tick, you will look for a bullseye rash, okay? Now, if you think you have contracted Lyme disease, you need to go to a doctor, but you need to know that there is a 50% false negative on Lyme disease testing. So if you get tested and the doctor says you do not have Lyme disease, but you have the symptoms like chronic fatigue, fuzzy head, these symptoms mean that you have Lyme disease. And when you see that bullseye rash, that is most likely Lyme disease. So what can you do at this point? This is a crucial time, and my friend will tell you that this is very important. There is an antidote. It is called Doxycycline. Doxycycline is a very strong antibiotic. They do not recommend giving it to children under 12 because it will turn their teeth yellow. But who cares? This will treat and cure the Lyme disease if you do it quickly enough. So within a very short, maybe 2-week time period, you can use this to treat your Lyme disease. If you do not, then you can have chronic Lyme disease. And another thing to know is that the CDC does not recognize chronic Lyme disease. So that means that insurances do not cover chronic Lyme disease. You will pay out of pocket for your treatment. So if you think you have contracted Lyme disease, you need to be your own advocate with doctors. Find a doctor who will prescribe you Doxycycline. And from the advice of my friend, whether or not it will turn their teeth yellow, you should use this antidote. So I hope that you join us with any questions that you have. You can put questions below this video, and my friend, who is very knowledgeable, and I know she wishes she was not knowledgeable about Lyme disease, she can answer your questions and help you. So I hope you join us. I hope you share this video. Share awareness that Lyme disease is dangerous. May is Lyme Disease Awareness Month, so I would be so grateful if you share this with a friend. Thank you for watching. Please join us tomorrow at 4 p.m. Central Standard Time for a live question and answer session about Lyme disease. Thank you for watching.